to go.
Excellent. Well, I'd like to call to order our joint Flagstaff City Council and County Board of Supervisors meeting this Thursday. I would like, if he's willing, Chairman Ryan, would you please lead us in the Pledge of Allegiance?
I sure can. And if everybody would please rise and join us in the pledge. And if you don't have a flag before you, the protocol for that is to face east. So if you join me, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Chairman. Councilmember McCarthy, will you please provide the city mission statement?
It would be my pleasure. The mission of the city of Flagstaff is to protect and enhance the quality of life for all. And I'd like to add that I believe the county would agree with that.
Thank you, Councilmember. Well, before we take roll, I just want to first congratulate all of our county board supervisors for their elections and re-elections, and I am very excited to be working with you all. City Clerk, oh, my apologies. I wanted to give the little bit of guidelines on how we run things here at our meetings. If you would like to have a comment or question, just please put a C or a Q in the chat box. Anything that is stated in there needs to be verbalized. So best practice, just stick with the C's and Q's, and we'll let you verbalize it as they come up. Excellent. Well, City Clerk, can we please have roll call?
Chairman Ryan.
Present.
Vice Chairwoman Fowler.
She's visual out there.
I see her. Thank you.
I'm here. Thank you.
Supervisor Archuleta.
Present.
Supervisor Begay. Supervisor Hortzman.
Present.
Mayor Deasy.
Here.
Vice Mayor Daggett.
Here.
Councilmember Aslan.
Present.
Councilmember McCarthy.
Here.
Councilmember Salas.
Present.
Councilmember Shimoni.
Present.
Councilmember Sweet.
Present.
Thank you. One thing I forgot to mention too is that on our city council meetings, we really like having the person who is speaking to have their video on. It's always great to see the faces and everything else. So just to let others know. City Clerk, do we have anyone for public participation tonight?
Yes, Mayor, we have one public participant and they are on the line.
Excellent. Go right ahead.
Hi, Liz. You can go ahead and speak now.
Awesome. Thank you. Hi, good afternoon, everyone. I thank you for this opportunity to speak on behalf of High Country Humane. My name is Liz Olson, and I'm the executive director here at the shelter. It's our third year of operation, and we really appreciate your service to our community and the animals in our care. I wanted to give everybody a quick snapshot of 2020. We saved over 2,955 animals that came through our doors from either the city of Flagstaff or Coconino County. 1,573 of them were spayed and neutered. 1,829 were put into foster care. And we adopted out 1,955 animals into forever homes. We were able to transfer about 375 animals to other shelters who might have more room than us or a better situation. There were 783 public animals spayed and neutered, which is really, and 950 clients were served by our vaccine clinic. We also helped over 300 families with our pet food bank. But it is definitely with your commitment to this partnership that we are able to celebrate being the best place to adopt a pet. We came in second place as the best nonprofit organization by the Best of Flagstaff Awards. So we're really appreciative of that and excited. Your support of High Country met with a lot of gratitude and appreciation, not only from myself, but our staff and our board of directors. So I wanted to thank you again for this opportunity to speak today, and I look forward to working with everyone in 2021.
Excellent. Thank you, Executive Director Olson. We are now down to agenda item number 5, the 2020 U.S. Census Bureau report and recognition.
Actually, Mayor, this is City Attorney Sterling Solomon. I just wanted to verify, I did see another number come in. Do we have any more public participation, City Clerk?
No, we do not at this time.
Okay, I saw another number join and I just wanted to make sure. Thank you.
Thank you, City Attorney. All right, the U.S. Census Bureau report and recognition. Staff, please take it away.
Okay, good afternoon, everyone. My name is Tammy Parisi with the U.S. Census Bureau. Thank you for the opportunity, Mayor DC and Chairman Ryan, to be a part of this meeting today. I will be sharing a short presentation with you all. If someone would please let me know that the screen is shareable here.
I'm not seeing it quite yet here.
Okay, I should be close.
While you're doing that, just to note, Supervisor Begay has joined the meeting by phone. Thank you.
Thank you.
Thank you.
Screen
Welcome,
is visible.
Supervisor Begay, and congratulations, Supervisor, for your election. Go right ahead.
Okay, hopefully everyone can see the presentation here now that I've shared my screen. Just a very quick presentation to really recap the 2020 census and let you know what's next year in 2021. Okay. Assuming the audio is working fine here, I think we may have a short delay, so I'll just keep talking unless interrupted to show otherwise. The response rates nationally to the 2020 census, specifically the self-response rates for the nation, came in at 67%, and that was higher than our projected percentage of 65.6 and even higher than that of 2010. So clearly, the American households know the importance of the decennial census, and 67% of American households in our address file did respond on their own. This was our first nationwide census available online, and we are happy to report that we had not even 1 millisecond of downtime, nor any data breaches, and the average response time was very short. My household took about 5 minutes, but average time took about 9 minutes. So very quick. Around 10 minutes of a household's time to complete this very important data collection for the country. Overwhelming majority of households did prefer to use the internet option at nearly 80%, but the Bureau did not want to limit the ability to respond through other means. So we had mail and phone representing a small percentage. More mail than phone, but again, majority of households chose to respond online. You may be asking, well, what about those households, the 33% of U.S. households that chose not to self-respond? We conduct a non-response follow-up operation to ensure that we have reached every household in our address file. Despite the COVID pandemic, we were able to enumerate 64 million addresses in a 68-day time frame, which was more households in less time than what we saw in 2010. So we were on the ground running. Despite the pandemic, our staff was issued PPE to keep themselves and American households safe. As with every decennial, we do have a percentage of non-response follow-up that is resolved using proxy records. And what I mean by proxy records is if a household did not answer the door upon repeated attempts, we used proxy data to complete that household's decennial count. We could have used the neighbor, the church, someone who knew how many people lived in the household. And that comprised 24.1% of our NARFU workload. In addition to that, we always use high quality administrative records to again help us go through the non-response follow-up operation, and that was less than our projected 22.5%, coming in at 13.9%. So COVID pandemic slowed us all down, but the census remained dutiful in what it needed to do for its constitutional requirement to count everyone. For those people not residing in traditional household settings and maybe lived in a group type setting, such as a nursing home, maybe a long-term resident of a hospital, a rehab, even the incarcerated population, we count them in special operations known as group quarters, targeted non-sheltered outdoor locations for the homeless, and service-based enumeration for those housing people who do not live in regular household type settings. So the graph that you see before you indicates that the blue line is the 2020 census, and you can see that we enumerated 215,000 group quarters locations, 37,000 targeted non-sheltered outdoor locations, and 53,000 service-based enumeration facilities. So we counted everyone. On the ground here in the Denver-Dallas 12-state region, which Arizona is part of, it took a lot of work combined with the city and the county to start marketing the census. And I'm a partnership specialist, and we had 313 in the region, and we did have specifically trained tribal and media to assist us with the tribal and media partners as well. We hired about 50,000 enumerators to help us go door to door. And if that were not enough, we used enumerators from other regions to help the Denver-Dallas region. I can safely say, having been a part of the Navajo Nation area census office, that if we don't have enough enumerators on the ground, we do get them from another region to help. So we adapted to wildfires, social unrest, the pandemic, the list goes on and on. We're no stranger to a challenge when it comes to the decennial, so we get busy and quickly utilize our resources to get the job done. The city and county was one of our 67,000 plus partners, and we're so thankful for the Complete Count Committee, the rural outreach team. I've had the opportunity to meet with many of the city and county staff as they sponsored the area census office opening there in Flagstaff. And I want to say thank you. I know there was a ton of work done with the Complete Count Committee. And if I tried to list everyone, I'm certain I would miss someone. But the Complete Count Committee in the city and county combined was one of our very early Complete Count committees, and really the CCC that we said one should emulate. Very well organized. So again, thank you so very much for forming a Complete Count Committee and not letting COVID derail your plans either, but instead just adjusting. Arizona finished 32nd in the nation for self-response, but still at a good percentage. 64.1% of the households did respond on their own. Again, wonderful percentage. We are a border state. Of course, I don't have to tell you that. So being 32nd was no shock to us as we work to enumerate and really market the census that it's easy, safe, and important. So 64.1 is a great percentage. Coconino County as a whole for self-response finished at 46.5%. That was a little bit behind 2010. And I'll talk about not comparing 2010 to 2020 in just a moment, because that could be discouraging, but in no way do we want you to feel discouraged, because there's some difference in boundaries. In terms of how the city of Flagstaff performed, 60% of the households responded on their own. Again, remarkable work by the city and the county to really encourage households to self-respond to the census despite the pandemic. I know you have a lot of vacant homes in the area or vacation or second homes. So we exhausted every household in our address file through the area census office to make sure everyone was counted. Other municipalities within the county, here you see their self-response: Fredonia, Page, Tucson, and Williams. Again, don't spend too much time drawing a comparison from 2020 to 2010, as it's not an apples to apples comparison. Rather, it's an apples to an orange because the 2020 self-response rate map that we showed to the public did represent planned boundaries. So that will likely change. So, and when I say likely change, the 2010 boundaries may not have been the same as 2020. So I think that's an important distinction. And backing up for just a moment, because this was a question at a previous CCC meeting, what does self-response really mean? It meant the unduplicated responses, whether they came in online, mail, or phone, whose household address was in our master address files. Years of work goes into decennial planning to ensure that our address file is correct. And that includes working with municipalities and the counties in several of our pre-decennial census operations, such as local updated census addresses. You probably know them as the acronym LUCA. Certainly the planning department would have helped us with that. And just for some reassurance, households did not have to have that unique ID that came on their mailer, and they could respond without it. Again, the Census Bureau did not want to impose any barriers to participation, so we did not require that unique ID number. It's all about matching a response to an address on the ground. So another question that came in from the Complete Count Committee, did all self-responses show on the map? And the answer to that is yes. If the response matched the an address in our universe, our master address file, we did indeed include it on the self-response. Any non-matches were placed in the non-response follow-up for resolution. We saw quite a bit of that on the Navajo Nation just because of their type of address descriptions. But what you really want to know, probably at this point in the game, we are at the latter part of January. In a normal decennial census, we would have met the statutory deadline to release the state population counts December 31st. Clearly, I do not have to tell you that they are not yet out. If you are following NPR radio, they have given a projection of when to expect the data. The Census Bureau has not released any public release or press release on the matter as of yet, so I do not have a firm date for you, and I apologize for that. The same set of circumstances relates to the redistricting counts, the local level data. Normally, we would publish that March 31st or by March 31st, and I just don't have an estimated date when you can expect those. I could speculate, but I'm not in the business of speculation on something so very important. What I can tell you is I hope that the city and county has followed along on census.gov or seen our press release that redistricting package information has been released. So at least you can kind of look through the shape files to get busy working on redistricting counts. Of other important note, and I'm trying to be brief here, post-enumeration survey, that is our quality check on ourselves for the decennial. That every single operation that we ever have has a quality control operation. And the quality control operation for the decennial 2020 census is called post-enumeration survey. It is happening right now. So the Census Bureau is always on the ground. So if you have citizens wondering why the census may be at their door, it could be an ongoing survey or post-enumeration survey. So we are doing a check on ourselves. Again, the under or over count in no way changes the outcome, of the decennial numbers. It's just our report card for ourselves. Ongoing monthly surveys, the American Community Survey. If you want to know what your community looks like at a local level right now, we did release the 5-year estimates called the American Community Survey. The American Community Survey is the long form of what used to be the long form decennial census, but we do the 5-year estimates and we release those back on December 10th. You can drill down the data right down to the tract level to see what your local numbers look like right now in advance of the decennial count being delivered. It's always important to know that the Census Bureau is always hiring in every community or in the community who may need a field representative or an interview to go door to door. So please help us continue to market that we have positions available. We do have our top 5 household surveys projected here on the screen. The household pulse survey is continuing, and that measures the effect of COVID-19 on American households. So the Bureau just extended the household pulse into a phase 3, just announced that. So if you want to take a look and start digging in the data, that household pulse survey is specific to COVID-19. And then here's some other of our top surveys that we produce regularly. You can get really lost on the census.gov website, and the Census Bureau has so much data. If the city or the county is interested in learning more about our data, how to access it, we do have a data dissemination program. That is a free service that we offer to the public, and it takes a simple email to census.askdata@census.gov to say, I want census data training, again, to learn how to drill down into our data. There's so much on there, and our staff can help you. But again, what I'm really here to say today, and thank you for your patience in allowing me to go through this presentation, is thank you from the Bureau for supporting the 2020 census in a mighty, mighty way. Some names that come to mind, and I apologize, I'm going to miss some here. Kim Musselman, Sarah Dechter, Supervisor. Oh goodness, the name is escaping me. Many of you, thank you so much for supporting the 2020 census in the way that you did. We'd like to invite you to a reflection summit, and I'll reach out to both Sarah and Kim to see if you might be interested. Any feedback that you have for the Bureau. I know there's a report being done by the Complete Count Committee. We'd love to hear it so that we can help what the 2030 decennial looks like. So with that, I have FedEx some certificates for the county, for the board, and for mayor and council. And again, thank you so very much for all the support that you provided to the 2020 census. You clearly made it a priority to get everyone counted, and we thank you for that. And with that, my presentation is complete. Does anyone have any questions I can answer?
Mayor, you're muted.
There we go. Thank you, Ms. Parise, for all of your hard work and the whole team. I mean, this is a huge, massive lift, especially amidst COVID. Councilmember Shimoni has a comment.
Thank you, Mayor, and thank you, Ms. Parise, for the presentation. And I just wanted to express gratitude to the members of the City Council, as myself and Councilmember Whelan, that were appointed to this task force effort, and Sarah Dechter and our city team, along with Kim Musselman at the county, along with former Supervisor Archuleta, and Ms. Fowler, Supervisor Fowler, for their efforts, and obviously the entire county team. This was not an easy challenge. This was a very challenging topic, and I think we did a good job, all things considered. And so this is a great example of where we came together between the city and the county, and we partnered up, and we worked together towards a common goal. And I think we did a good job. So well done. Kind of hard to believe it's over, or kind of over, but thank you, and much appreciated. Thank you, Mayor.
Thank you, Councilmember Shimoni. And Chairman Ryan has said that it was Supervisor Archuleta involved in the census in the comment section, or in the chat box. Do we have any other comments or questions from Ms. Parise?
I do have a comment. Thank you. This is Supervisor Archuleta.
Go ahead.
Thank you, Mr. Mayor. Chairman Ryan. So I do just want to also communicate my thanks to the just the really amazing team members, both from the city, the county, the university, the community college. I mean, there were numerous partners that were involved in this effort to ensure that people were counted, including business and industry folks. And so, as was mentioned by the speaker, this was a team effort, and certainly we were very challenged by COVID. The one thing that we did have working in our favor was that we did start very, very early. In fact, we started 2 years early than many people started, and so because we knew this was going to be a critical count for our community, and just the heavy lift of trying to have a census during a time of COVID and trying to be creative and innovative in getting people to complete their census was something that all of us took very seriously. And so I do want to also just want to recognize our county folks, Kim Musselman, who along with Sarah from the city just provided immense leadership. Certainly, Councilmember Shimoni and Councilmember Whalen, along with the Board of Supervisors, provided the budget and the staffing and certainly the leadership to make this happen. And so I think we can all be very proud as a community of what we accomplished, and looking forward to utilizing the data to make some very critical decisions that are going to be coming up for our community in terms of redistricting and in terms of representation that we might have because of that. So thank you very much. It was a pleasure working with the city, and it just shows that what we can accomplish as in partnership and as a team effort with our cities and through our county. Thank you.
Thank you, Supervisor Archuleta. Do we have any other comments or questions at this time from council or other supervisors? All right, Ms. Stechter has a comment.
Thank you, Mayor DC. And I would like to take a moment on behalf of the Flagstaff Coconino County Community Census Team, which was the name of our complete count committee, to thank the Board of Supervisors and the City Council for their support of this effort and for helping staff get a very early start on the census. I think the council at the last meeting got a quick widget slide from the community development group on how the census went. In the city of Flagstaff alone, we corrected 14,000 addresses out of our 24,000 addresses for the census prior to operations even hitting the ground. Those kinds of efforts, the ability of our GIS staff, especially the GIS staff at the city and the county, did a very outstanding job of quality control on the data that we were sharing with the census. And that early start is really necessary. So I hope it's something that we can do again as we get to 2028 and you start sending whoever you would like to take on these roles down to Phoenix for trainings. That was huge in our effort. We were well ahead of other rural counties in Arizona. I also want to particularly thank Greg Webb, who's an employee of the county, who served as our census outreach coordinator and made contact with over 100 nonprofit organizations and did his very best to organize volunteers and coordinate with the census to provide resources in the middle of a pandemic. And now he serves and he's helping at Fort Tuthill with the public health outreach there. So we are really grateful. He did an enormous amount of lift, as much as Kim and I did. You'll see in your packet that there are over 89 certificates of appreciation going out to members of the team. And you'll see that it is a very diverse group from all over the county. And so if you run into any of those people in your world or in your virtual meetings, please be sure to thank them. From the bottom of our heart as an organization, we really couldn't have done this effort without them. Thank you.
Thank you, Ms. Dichter, for all of your hard work and everyone's hard work with this. Such a huge lift and taking so many hands, and I really greatly appreciate it. Well, Council, if we don't have any further comments or questions, I do believe we are down to agenda item number 6, which is our. Oh, I'm sorry, Supervisor Fowler.
Yes, I like to just add to the thank yous, and it was such a challenging event that we went through. even changes from the federal government on the dates and times and how. But it's really, census is really telling us like what we're doing right now. Vaccines are being distributed by population. So it is so important. And it's really teaching us how the census is used in every sense of our decision making, and we just really need to continue to educate our population about the census and why it is so important. 10 years from now, we'll be doing it again. So thank you so much. Thank you for everyone that was involved. We had a lot of volunteers in the community as well. So thank you so much.
Thank you, Supervisor Fowler. Well, at this time, I think we are ready to put to the next agenda item. We are to the agenda item number 6, which is our COVID-19 update. City County staff, please take it away.
Good evening, Mayor and Council, Chairman Ryan, and Board of Supervisors. It's a pleasure to be with you this afternoon to provide some overview as to our COVID update and also some detailed information regarding the vaccine rollout. Before I get started, and for those of you who don't know me, my name is Kim Musselman, and I serve as the Interim Health and Human Services Director and also the Incident Commander for COVID-19 response. And Mayor, if I may, just before jumping to that, I just wanted to echo the thanks to all of the team that worked on the census efforts, to Sarah Dector and to Greg Webb and all of the numerous city and county staff who worked tirelessly, as well as all of our partners, both in the private, nonprofit, and business sector. As Supervisor Archuleta mentioned, it was truly a team effort, and really appreciate, especially on my own behalf, Sarah and Greg and others really stepping in as COVID took over and my attention was diverted elsewhere. So I just wanted to echo that thanks and the thanks of the support of the city and county. So with that, I'm going to share my presentation. And just confirm that you are all seeing it on the screen.
Good to go.
Thank you, Mayor. So where I want to start, just briefly, I know that both the Board of Supervisors and the City Council, I know you are receiving regular COVID updates. That Deputy City Manager Shannon Anderson, I know, does a fantastic job weekly presenting update on numbers. And so I'm not going to spend a whole lot of time, but just to point out, because this is why we're doing what we're doing, and it's all about the community transmission and COVID in our communities. And this is just the snapshot of the slide from the page in our weekly report, our COVID weekly updates that are published every Friday on our Coconino County website. Any member and anyone with access to the internet is able to go pull down this report. We also send it out among multiple different partner organizations on a weekly basis. And so I just wanted to point out, this was from last week. Report with the week ending January 16. Tomorrow's report will come out for our week ending January 20, whatever day Saturday was, I think January 23rd. And just remind everyone, certainly we have had an incredibly high incidence rate of COVID, and with almost 700 people per 100,000. And our percent positivity is still sitting at about 18.3%, and our COVID-like illness incident is at 22%, which is incredibly high. And as to all the benchmarks, state benchmarks, we continue to remain insubstantial in all categories. Just a quick snapshot here of the, whoops, excuse me, clicking the wrong place. A quick snapshot here of just the weekly data of cases, positive cases since the beginning of COVID, back when our first case was reported back in March. And just want to point out, as I said, the report for the week ending January 23rd is going to be coming out tomorrow, and we'll have more firm numbers around that. But the good news, we've had some really bad news for many weeks, as you can all see, but slowly we are creeping down in terms of that total number of positive cases, which is a very good sign, and really contribute that to everyone practicing good social distancing, physical distancing, washing your hands, wearing your mask in public, and avoiding large crowds, and ask for everyone's continued diligence around this, not only now, but as we go into implementation of getting as many people vaccinated as possible. And even after you're vaccinated, we need folks to continue to practice the mitigation measures for a significantly long period of time until we can truly reach herd immunity, which is still many months out. So please continue to encourage everyone to practice good mitigation measures. Sorry, okay, apologize. So I want to just take a step back. I know that there are some new council members, new mayor, and as we have been actually experiencing all of our COVID response now for a little over a year, I'd just like to take a quick little walk with you all, if you don't mind, and talk about kind of our response timeline and how the county has been responding to COVID since January, a whole year ago. And back in January, we had our first confirmed case. Our country had our first confirmed case of COVID, and in Coconino County. And at that time, we established our incident command team, and that was activated in anticipation of knowing when we were going to have our confirmed cases and that this was going to turn into a worldwide pandemic. So in March of 2020, Coconino County issued the state of emergency, declaring declaration for the pandemic. Our emergency operations center was opened, and we opened up the first drive-through testing operations in the state, and certainly stood up through the county to start testing for positive cases. County also stood up the first isolation and quarantine hotel under the Tier 1 alternative care site, which was the first in the state, and used that as our mechanism to assist those unsheltered populations and those experiencing homelessness and others that could not return home due to exposure and being COVID positive. We also, at that time, our county, and I know the city did as well, transitioned to a reduced facility model because of the pandemic. In May, we started participating in state testing blitzes, and our ongoing testing was able to expand throughout Coconino County, including initially standing up in partnership with North Country Healthcare and on the community college site, and then later going down to one large location at Fort Tuthill for ongoing testing, and then taking our testing on the road and around and throughout cities and towns throughout the county. That allowed us to expand. And also our county, and I know the city as well, started developing reentry plans at that time in anticipation of when we could return back to our normal city and county operations inside of our buildings. And as we all know, that continues today because we're not there yet, ready to re-enter, and have had to stop and start a couple of times. In July and August, we partnered with Federal Health and Human Services to bring additional self-administered testing to Flagstaff and Williams, and ran several weeks of that. We also submitted for CDC grants and funding requests to be able to help absorb some of the costs that were being incurred by the county and county taxpayers for the services that have been being provided throughout the pandemic. In September, we opened the ASU, in partnership with ASU, the saliva-based testing operation at Fort Tuthill. And you will all note as well that NAU also partnered with us and with ASU to open testing on NAU campus at the field house. In September, we also received the funding from those CDC grants that we requested in just under $3.5 million that allowed us and continues to allow us to be able to pay for staffing and many other operating expenses around testing and certainly our contact tracing, surveillance investigations and monitoring, and then now more recently, the transition away from our primary focus of testing, which is now our primary focus of vaccinations. We also in September transitioned the current isolation and quarantine hotel that the county had been operating to a partnership model with Flagstaff Shelter Services, and that has been ongoing since September. And in October and through December, and beginning in even earlier than October, but our county vaccine planning began, along with us distributing Bionex Now testing kits to help distribute those throughout the county for some rapid testing that was available. FUSD is also a partner in learning how to bring these on so that they can utilize these in their return to school plans. And we have continued applying and preparing for vaccine allocation, which came in late December when the county started receiving vaccine allocation from the state. The county's role is to be the distributor of the vaccine as it comes into the county, at least in these early phases of the vaccine implementation. And we started distributing vaccine to a couple of hospital partners in late December so that they could start administering vaccine to our phase 1A healthcare worker population. That included Flagstaff Medical Center, Page Banner, and North Country Healthcare were initial partners who were distributed vaccine in those early phases to start vaccinating their healthcare staff and others. And then in January, they transitioned into opening those to other members of the public that fit into that phase 1A category. In January, on January 4th, the county opened our Fort Tuthill vaccination operation, utilizing a mobile administrative unit. For those of you who have been out there or who haven't, we have 2 mobile trailers out there, one that the county sheriff's department has loaned us for use to keep our medical staff and administrative staff warm and out of the elements in between times when they are going out to cars to provide vaccination, and also another smaller mobile trailer that was borrowed to us from Patty Hansen, our county recorder, that they had been able to receive during election time. We started vaccinating in January 4 in that 1A population, and within less than 2 weeks, knew we had available appointment capacity because the healthcare community had not responded maybe as quickly as we had hoped or with as much interest early on with scheduling those appointments for whatever reason. But we knew there was a lot of interest in those early phases of 1B. And so we made the decision to open up our appointments in our initial allocation that was under the 1A allocation to the 1B priority groups so that we could begin expediting distribution to our communities and those that were eligible and ready to receive vaccination. We also in January have applied for some additional resources for vaccination support, and I'm going to get into some of that a little bit further in this presentation. Just wanted to speak for a few minutes about some of the successes to make sure people are aware of all the things that are going on, not only with testing, but then also already in vaccinations. This number here that the COVID-19 testing totals to date, and this was as yesterday, we're at 96,000 people that have been total tests to date. There's going to be new information coming out in our weekly report that's actually going to start breaking that by actual people and also numbers of tests, which I think you will all find interesting. We have had a great record of having testing available free of charge to our communities, and lots of people taking advantage of being tested. To date, and again, this was as of yesterday, as far as sheltering totals for the Tier 1 alternative care, we have sheltered 640 individuals to date. And as of, this was yesterday's report that can be found on the ADHS website, there was a total of 13,275 vaccines administered countywide. And that has us in what is now the second highest rate per capita in Arizona. We've been sitting at the first as the number one highest rate per capita until just yesterday or the day before, when Greenlee County surpassed us. But I would just argue that Greenlee County has an incredibly small population. So we're very proud of the things that we have been able to accomplish in such a short time. And we've only been able to accomplish it because of our one county response and the diligence and hard work of all of the staff involved in the incident command and our emergency operations, and all of the support from all of the county employees and others throughout our communities. So with that, I just want to share a little picture. This was the first snowstorm, not the one that we just now have, 2 to 3 feet of snow on the ground. But just want to share with you, these are some of our nursing staff who have been out at Fort Tuthill providing vaccinations to our community since January 4th when we opened it. And they are out there smiling and under those masks, as you can see in their eyes, and providing incredible service to the residents of our communities. So now I just want to speak about the realities around our vaccine availability and shortage, and where we are and what we're looking forward to going forward into the future. And just to kind of lay some groundwork and understanding for everyone about what our challenges are around getting people who want to be vaccinated. And I'm going to say this a whole bunch of times tonight, but our key factor in everything that we are doing, and even in everything that we plan for, is around vaccine availability. With that being said, the county, Coconino County, receives less than 2% of the state's vaccine allocation, which is based on population. You all are fully aware that our population is only a small percentage of the state's population. We have had just under 12,000 first doses. Again, this was as of yesterday's information, allocated to Coconino County by the Arizona Department of Health Services between December 23rd and January 22nd, ranging from 600 to 2,500 doses per week. So if I could just put that into context, we've now, this will be our 8th week of receiving vaccine allocation. And on average, we are lucky to be getting about 2,100 doses per week. And that's an average, because some weeks we're getting 600, some weeks 900. Last week we got over 4,000 doses, many of which were included in second doses. And today we were allocated 2,300 doses for this week. So there's little to no predictability in the allocation that we are receiving right now. With the allocation we have been receiving, this is kind of the breakout as to what is staying with Coconino County Health and Human Services that we are distributing out of our Fort Tuthill location, and then the percentage, which is just under 38%, and our partners, our medical healthcare partners that have been onboarded since the beginning, and many others that continue to come on board on a daily basis. Many of those include, as I said earlier, FMC, North Country Healthcare, both, and two different locations for North Country Healthcare, including Flagstaff and the Grand Canyon, and they will be bringing Williams online here soon. Page Banner, Canyonlands in Page, NAU, and I'll speak to that in just a minute in terms of their onboarding and are vaccinating their eligible 1A and 1B priority populations. The Vera Clinic, which is our NAPEP clinic for our employees, just started administering doses this week. Northwoods Medical and Flagstaff Family Care have onboarded and have not yet started administering vaccine, and many, many more that I'm going to share in another slide here in a minute. But just want to point out again what those key factors are that are dependent in our vaccine administration. And again, it's vaccine availability is the number one, and then how that distribution of allocation goes out, and ultimately our partner and our county capacity in terms of how much vaccine we could actually administer if we had the vaccine allocation to put into service. So I'd just like to point out here some of the external and internal factors that we've been dealing with so that there is an understanding of how decisions get made, the things that are out of our control and the things that we do have control over. And I'd like to start with, just explaining, I know there's been lots of questions about how these phased priority populations, 1A, 1B, 1C, all the things you're hearing, and I'm going to show you an infographic in a minute as to where we are here in Coconino County and also in alignment with the state. But ultimately hoping to help everyone understand that prioritization of the populations to be vaccinated and in what order ultimately came down through the Center for Disease Control, the CDC. Everybody's used to hearing that word these days. They made recommendations from a federal level that then go to the state. And then there is a state vaccine and antiviral prioritization advisory committee that we endearingly refer to as VAPAC, because it's a lot easier to say than the full words. And that committee has numerous people that sit on it, and they review the CDC recommendations and then make recommendations for the state that then go to the Arizona Department of Health Services. And that is what is then funneled out to the counties for implementation. So those decisions, for the most part, are made entirely out of our control with what the phases are and the order in which folks are eligible. The other incredibly important piece that I've already said before is about vaccine allocation. Again, this is federal and state. This is the allocation that comes from the federal government to the state, and then the state allocates it out to the counties. And I'd just like to point out at this piece, I know we're hearing in the media lots of things, and we're hearing lots of things with even the Biden administration announcing many different things just in the past week or so. And I know many people are hearing what is very hopeful news, and I myself am incredibly hopeful with the administration announcing, contracting to secure another 200 million vaccines, which sounds amazing and wonderful. But the part that doesn't get mentioned or called out to help our residents understand is that these vaccines may not actually be available until July or August at this point, and that there are contracts for manufacturing that are being put into place. But this vaccine isn't just sitting on a shelf waiting to be pushed out. And in fact, I will share with you that some of the information that we had been under the understanding was in play was that there were a whole bunch of second doses that were sitting at the federal level in reserves, and that it was going to be pushed out and we were going to see a whole bunch more vaccine. And what the reality was, they had actually been pushing that out all through the end of December and early January. And there is not a stockpile sitting at the federal level at this point in time waiting to be pushed out. There's obviously lots of efforts going on to manufacture additional vaccine. Also, other things that are outside of our control, but right now are in a very positive light, is our volunteer National Guard availability. We have been very pleased with the National Guard has been supportive of Coconino County's efforts in this pandemic from the very beginning. We have made numerous requests and have received National Guard staffing to help, that is helping us at numerous levels, and additional staffing that is to come that I'll share with you in just a little bit. But they have been doing everything for us, from helping with our Tier 1 hotel operation early on, traffic control, helping out at the testing site, now at the vaccine site, doing some triage and other things. So we're really grateful for that partnership, because that is also something that is not billed and charged directly to Coconino County residents and taxpayers. We also, of course, have our HHS service provision requirements that are mandates, if you will, from the state, also out of our control, funding allocations. And when this slide was published or put together, we did not have any FEMA reimbursement, even options for vaccination to date. However, today we actually just received some notification and coming from recent announcements out of the current administration that there is going to be the potential for some public assistance reimbursement through DEMA and FEMA. And actually our DEMA representative just reached out to us this afternoon. So that is good news that we hope to be able to have some possibility of recovering some expenditures that we have been putting out to date related to vaccinations. Other external factor we don't control is the performance or the capacity of our vaccination partners. I'm going to speak more about this in just a little bit, but ultimately, mentioned many on board with us, but that is that we don't run their operations. That is their book of business. We also don't control the type of vaccine that's received or subsequent requirements. This is dictated by state allocation and the distribution model. And I say this for a couple of reasons and want to just remind folks that we are not in a position, and nor are we going to be going forward, to, if people say, oh, I would rather have this type of vaccine than, the Pfizer vaccine than the Moderna vaccine. We are administering both in Coconino County right now. All of our partner organizations are administering Moderna. That's what we had been administering. Just this week, we started also administering Pfizer because we were able to get one tray of Pfizer allocated to us early on. I don't know how much more we're going to see, because right now that's all being directed to those state-run mass vaccination sites in Maricopa County and Pima County. We hope in the future that we are going to get more Pfizer allocated to us and just more vaccine in general. And then, of course, another external factor that I just bring up is vaccine hesitancy. When people are not sure that they want to get the vaccine or may not be able to get the vaccine for other reasons as dictated by their healthcare provider or other reasons. And right now, just to share with you all that hesitancy, it used to be a lot higher when we first started getting ready. The initial surveys were saying it was about a 50 to 60% hesitancy rate, and that has since decreased, which is wonderful news from my perspective and where we sit in public health, that it has dropped down to 30 to 40%, because that is how we're going to get to herd immunity, by having, at least 85% of our population ultimately having been vaccinated to be able to achieve that. County controlled factors are our prioritization of our strategic policy and how we're implementing things. Certainly our staff allocation from the county and resources that the Board of Supervisors makes decisions on in terms of allocations of our resources, and then of course our staffing schedule. So wanted to draw attention here now to the slide that has the phases. And as I'd mentioned in the previous slide, these phases were determined based off of CDC recommendations that then went to VAPAC and then were pushed to Arizona Department of Health and then out to the counties. And I know you've heard a lot around this. This is currently on our website where we sit in our current phases, and that is that we are vaccinating 1A, which are our healthcare workers and our healthcare support occupations, emergency medical service workers, and the long-term care facility staff and residents. And before I move on to the 1B, I just want to call out something here. I know this has been questions by many, rightfully so, in terms of our long-term care facility staff and residents. This is being run by a federal pharmacy program with CVS and Walgreens, and the allocations for that vaccine are coming directly from the federal government and also now being supplemented to some extent by the state. This is a program to vaccinate our skilled nursing facilities, our assisted living centers, and our group homes. And while these are under 1A, we certainly share the frustration that this has been a slow rollout on behalf of the federal pharmacy program. We do not currently have local contact information for CVS or Walgreens. We do know that they are vaccinating currently in our communities. We have had a couple of our long-term care facilities who have received vaccination, and we have received notice that there are a couple of other entities that are scheduled to receive vaccination beginning next week. We have asked the state repeatedly for some reporting on this so that we can share it with our communities. Just asked again this afternoon on a meeting and was told that they're going to try to get us some information. So I apologize that I don't have more detail than that at this time, but we just know that we are asking and advocating to have that information because it's incredibly important. So now the other piece or phase that we are in is our 1B priority groups. And as you can see the little orange box around all that, as you will all note, about 2 weeks ago, 1B priority was our education and childcare workers, our law enforcement and protective services, which specifically includes other corrections staff and security related work and fire personnel fall under that category. And about 2 weeks ago, it was adults 75 and older. And then as of 2 weeks ago, that age was moved to include 65 and older as the priority within 1B. The later phases of 1B include those other essential workers, which we know in Coconino County is a huge pool of our residents. And I'm going to show you a pie chart here in a minute that kind of breaks that out. And other critical government services fall under that category, which again is a large number in Coconino County, knowing all of the government services work that we do, not only here in Flagstaff, but all around our county and multiple government entities that perform those services. And then the next group that's also included in that later phase of 1B is adults with high-risk conditions in congregate settings. I just want to point out here, I know that there has been concern and advocacy around our unsheltered populations and those living in congregate settings, and the ask to prioritize that group. And I just want to say here at this point that we absolutely intend to have all of our unsheltered population and be part of our 1B later phase. We're just not there yet to be able to have enough vaccine to even get through those other priority groups that are currently within the phase. And as soon as we have enough vaccine to get appropriately through the other groups that are already highlighted, we absolutely will be working with, and North Country Healthcare has already indicated that they will be there to help administer vaccine to that group. And to our shelter populations and staff. So ask again for continued patience. I know this is frustrating. It's incredibly frustrating to me and to my team that there isn't enough vaccine for all the folks that fall into priority areas and are high risk. No group on any of this chart are, in my opinion, that no one is wrong in terms of where risk lies and who we should be prioritizing. And unfortunately, this is where we sit today with respect to our vaccine availability and the prioritizations that we have. So this next slide gives you a picture of kind of the numbers we're talking about in each of those groups. I think this is really helpful to help everyone understand the volume that we're dealing with, and obviously in correlation with the amount of vaccine that we're currently receiving. So I just want to draw attention at the top of this slide. We say Coconino County vaccination population at just under 99,000. And I want to explain why that number is there, because we all know our county population is, close to 150,000 people. And we'll see what it says when our census data comes out. But where we get this number is this number actually excludes the tribal populations that are living on nations, because the tribal nations have a separate allocation that funnels directly from the federal government to the tribes to vaccinate all of the population that is living on tribal and Navajo Nation lands throughout the county. So that number has been excluded from this total because everyone living on nation is asked to get vaccinated on those tribal nations. So that number has been subtracted. And then the other big number that's been subtracted out of this is children under the age of 14. The reason children are subtracted under the age of 14 is because there is no vaccine currently for children. And the only vaccine that is available for 16 years of age and older is the Pfizer vaccine, and Moderna is only for 18 years of age and older. So I just wanted to explain that to everyone where we are getting this number of vaccination population. Then out of that, you will see on this pie chart in phase 1A, The data that we have pulled from, again, census data and also DES, is that there was approximately 5,700 people that fell under that phase 1A healthcare providers category. And then in the 1B priority groups, we have 12,000, just over 12,000 who fall in that 65 and older category in Coconino County. And then the other priority groups, the law enforcement services and child care and education, makes up another 4,862 in that priority group. So you can see there that large number of folks that are part of the current phases that we were in. Then you look at the next big chunk of the pie, which is that 36%. This is what I was speaking to in terms of that phase, the later phases of 1B, which include our other essential workers and critical government service workers and those living in congregate settings. That is, just under 36,000 additional people that will be eligible in those latter phases of 1B. Then we move into 1C, that is others with high risk medical conditions, and that's about 8,000 remaining that didn't already also get encompassed in those other groups that you see before you. And then lastly, that phase 2 estimate, which is everyone else that didn't meet any of those other categories, which is still another just under 32,000 people. So hopefully that gives a good overview here in terms of what we're looking at of county vaccination population. Of course, we've already been vaccinating for the last almost month now. And so we're going to be utilizing this and kind of representing where we can subtract out of there and have an idea of where we sit. And I have one more slide before I'll pause for questions, Mayor, because I know this is a lot of information. Just wanted to point out, this is a snapshot of our partner vaccination operation capacity. And when I say partners, I want to be very, very clear that these are medical and healthcare related partners right now. And we have others who are onboarding regularly and almost daily that are saying that they can and want to be able to provide vaccination to our communities. These numbers that you're seeing on this slide are based off of longstanding history of many of these locations, not all, because obviously our hospitals don't normally provide vaccinations, but many of these other places that you see on the screen, including North Country Healthcare, Canyonlands, Vera, other places, they have been administering vaccines for a long, long time because they do flu and other types of vaccines. So these are numbers that they have indicated in their survey when they onboarded with the state that they would be able to provide per day, again, if they have a vaccine to be able to deploy. And as we continue to bring on other pharmacies are being onboarded frequently, we know and we do not right now allocate vaccine to the pharmacies, but we do know just this week we have heard that Safeway in Williams, Cedar, Flagstaff, Safeway, and then also in Page had received some vaccine, and Rise most recently here in Flagstaff. We are still trying to get, I just asked again today on the health officer's call to be able to get some information that tells us how much vaccine they're getting so that we can help share that information from the county level to our communities to know who has vaccine available. To date, we don't have access to that, and we are continuing to advocate that we get it. Just wanted to call out a couple of other things on this slide, which is NAU Campus Health and their capacity. They vaccinated almost 1,000 people this week and will be doing likely about that many more next week as well for NAU faculty and staff, and then in the 1A population, all of the students that fell into the healthcare provider category and faculty and doing clinical rotations and things throughout our communities as they are getting ready to become our future nurses, healthcare providers, dental assistants, et cetera. And then lastly, just want to touch on FMC has been vaccinating all of their employees. And then recently, when we went into the 1B priority areas, had administered some vaccine to our law enforcement community. They are looking at options right now to be able to scale up substantially and help provide vaccine in our community. And we've been working closely with them as they are working through some of the details and logistics around licensure and other things for an offsite location, and hope to be bringing some updated information to everyone soon as we can get some confirmation on that. And for the board, obviously, we'll be talking to you about those things, and for the council and others, we will be putting information out on our website, which I hope everyone will refer to often on our Coconino County page, and specifically our vaccine page. We have all sorts of information, including everywhere that is currently that we have access to and know they have vaccine, and how to schedule appointments. They can be found on our website at this time. So with that, I'm going to take a pause and ask if there are any questions that if this is a good time.
Yeah, thank you, Director Musselman. Just a quick reminder, if you could do little C's or Q's into the chat box, it helps to make sure everyone can efficiently talk and get their word in. And I don't want to, by any means, skip any supervisor or anything to that effect. So please just use that chat box for C's and Q's. I do have a few questions, but I'd like to open it up to the rest of council and supervisors at this time. Okay, well, I'll start. How about that? So in the last slide, it was 1,300 or so potential per day. If the Biden administration is able to fulfill that goal of 100 million in 100 days, are we going to have the personnel capacity to administer that? I was very hopeful seeing that, but that's been a big question of mine while thinking through this.
Yes, thank you, Mayor, Council, and Chair Ryan and supervisors. Yes, in fact, we have that capacity now for that 100 million in 100 days, because what that actually equates out to is only about 400 vaccines per day that we would be able to administer. We would be administering to accomplish that with respect to how that breaks out to our population. And we, as you can see by that chart that I had up there on that previous slide, we have sufficient capacity to be able to absorb that and continue to ready for any increase in volume that we may be able to get into our communities and administer. So we definitely have way more capacity to administer vaccine than we have vaccine right now.
Right, that's great. Is that the case for the counties throughout the state, or are we going to be seeing these issues in the surrounding communities?
So thank you for that question, Mayor. I would state that most of the counties are in a similar situation. Not all of them. Certainly there's some much smaller rural counties than even us, and their capacity with respect to what they're able to do on the county side is much less than what we are able to do, and that we're even planning to do in terms of being able to scale up. So I would say that most of them are, and I think that is kind of what we hear on the health officers' calls. We're having them twice a week. Most of those counties have, again, capacity and partnerships to administer vaccine. We just can't get enough of it to keep those appointments filled and keep them, so that people have access to appointments sooner rather than later.
Right, I was wondering about that too. Is if we're well suited and doing well, but Yavapai or something is not, then are we going to see an additional flood to our city to get the vaccinations and therefore be a little that's good to hear. Yeah. Is there data on the number of people who have gotten their second vaccination? Because I do see those total numbers of vaccinations, but are we tabulating it? Is it easy to find out that information to see who has maximized their resistance, I guess?
So thank you for that question. I do know that the state is providing some data around that in totality for the state. We have not started reporting that yet, because I will be honest, we actually just started. We're actually going to start at our county side administering second doses next week, with the exception of we did a few this week that were our clinical staff and others. And I know that the hospitals have started administering their second doses just in the last couple of weeks. And that is information that we need them to provide to us and or us to be able to pull out of how the state's gathering data. So I thank you for that question, because we would like to be able to get that information and be able to start sharing that as we are now moving into folks getting their second doses, because I think that's going to be an important piece of information for people to know. So thank you, and we absolutely intend to be able to track and show that information as soon as we're able to get our hands on it as well.
Yeah, thank you. Down the road, of course, but when we start looking at our reopening phases and such, that's going to be an important factor as we're deciding on, festivals this summer and such.
Absolutely.
So, great. Council and our Board of Supervisors, do we have any additional questions and comments currently for Director Musselman? Councilmember Shimoni, and then followed by Chairman Wright.
Thank you, Mayor, and good to see you, Ms. Musselman. I just wanted to say thank you for your efforts, and thank you to the county who oversees public health for all of your work during these very challenging times. I really think we've been a beacon and a model for stepping up to the plate and doing the best we can in the state. And I just have tremendous gratitude for all of you at the county. So thank you. Challenging times, frustrating times, and we're slowly getting through it. So just want to express my gratitude and say thank you.
Thank you, Councilmember Shimoni. Appreciate that.
Thank you, Councilmember. Chairman Ryan.
Thank you, Mr. Mayor, and hey, Kim, great job. Actually, more of a comment, just to reinforce that the board, along with our Health and Human Services staff, the county staff, definitely we know this is a priority for the community. You can see by the presentation that they've been working really hard on what they're doing. A piece for the sake of all the staff that are working out there. Boy, they're putting a lot of hours in, working really hard on behalf of the community. If anything, this is a time where we need to reassure the public that we are there to administer, but we also need patience as we work our way through this with an understanding we're limited by the number of vaccines that are available. When we get them, we're ready to implement, and that's a piece that we also geared up. So just putting that message out there, we hear people's desire to get the vaccines, and we're working really hard to do that. Thank you, Mr. Mayor, and thank you, Kim.
Thank you.
Thank you, Chairman. Do we have any other comments or questions before we press forward? Well, I will just quickly echo much what is said. Thank you so much for this hard work. You've been between a rock and a hard place for an entire year with this situation. I've seen a lot of lack of leadership at higher levels, but what I'm seeing here is a lot of leadership in our local community and with our county, and I sincerely appreciate that. Councilwoman Salas has a question real quick.
Well, thank you, Mr. Mayor. Well, first of all, I want to send grateful hearts, and thank you to all of our county health and human services staff and volunteers, and of course, our healthcare workers in the front lines, keeping our community healthy and safe. I just have my curious hat on as a citizen. So walk me through a process of requesting the vaccine.
Absolutely. Thank you, Councilwoman Salas and Mayor Deasy. So right now, how that works is if you fall into one of those categories and are eligible to be vaccinated at this time, how it's working in the county right now is we have had appointments that, of course, had a huge interest as soon as we had opened that up at our Fort Tuthill location, and then also our other partner locations. And so what needs to happen is if you are eligible, right now we have all of our locations and partners that are providing vaccination on our county website. If you go to the county website, you can look and see and click on each of the different locations. I will share with you, and this goes to the frustration piece. Many of them already are full with their appointments. There will be more opening up each week because, as I indicated earlier, we get vaccine allocation and we are pushing it out to our partners. And really the focus right now is pushing it out to those partners so that there are appointments that are earlier in February. Our appointments at our Fort Tuthill location, for the most part, are fully booked through the end of February, which includes not only first doses, but then, as we were talking earlier, about those second dose appointments. So all that information is there. If for any reason somebody has difficulty or doesn't have access to technology or any of those things, they can call our county call center. We have hours of operation every day of the week right now, 7 days a week. And Eric, our public affairs director, is helping me out here. He's putting in the chat the link to our website, which is our coconino.az.gov/COVID-19 vaccine. And if you aren't able to do that via technology, then you can call our information line and our call center at 928-679-7300. We are open Monday through Friday, 8 to 7. We've been assisting, and Saturday and Sunday from 8 to 3. We have been assisting numerous seniors who are having difficulties trying to schedule appointments or difficulties with technology. And we are taking calls, we are taking their information, and we actually have a team on the back end. Many of our team who works for our senior services program and our community services program, and others who are calling those seniors back to get information and actually helping them navigate and try to find open appointments for those seniors. We have also had some appointments that we have set aside for seniors at our county site so that we can plug them into those appointments, since we know they are not always able to be as technologically savvy as some of our other folks. But really, that's the best way right now. Certainly, you can also access online. We have the state locations, the site down at the football stadium in West Phoenix, and then they're just opening the Phoenix stadium site for appointments as well. And they are open to anyone in the state who is a state resident. So if folks are looking to find appointments outside of the county, they are able to access those state-run locations. So I hope, Councilwoman Salas, that answered your question.
Yes, very helpful. I have a follow-up question, though. So looking ahead, so I'm zooming into the category of 1C that prioritizes adult with high-risk medical conditions, because in other categories, you can verify the ages, right? The date of birth, because you plug in your birthday. But what about the adult high risk with high risk medical conditions? Will they be required to submit like a doctor's certificate of their existing medical conditions?
Thank you, Councilwoman Salas, for that question. I don't actually have a complete answer for that yet, because we're not there yet. Certainly, we are verifying people's eligibility in all of these other categories, and that is going to create somewhat of a challenge. But I also think, if you remember what that pie chart showed, we have such a large number of our population that actually falls into the 1B later phases. And actually, it's a much smaller percentage of the population that falls into that 1C. I'm hopeful that at that point, when we're ready to go there, that we'll get a little more guidance from the state as to how we're supposed to screen that. Obviously, we want to be mindful of screening questionnaires and other things because it is people's health information, and we want to be able to protect that. So I anticipate us asking screening questions. And, ultimately needing people to, be on their honor for the things that they are telling us, because we can only do so much within our capacity. So we'll be sharing more of what that'll look like when we're ready to move to 1C. So thank you for that question.
Thank you. Councilmember Aslan has a question.
Yeah, thank you. Oh my gosh. I'm not supposed to have that background. Sorry.
That's too funny.
That was from something. Anyway, I'll just ask my question.
Cover it.
So, and I'm sorry, Kim, if you've already answered this, but what happens if you have a reservation for vaccination and earlier slots open up?
So one of the things that we would ask, especially, and I would ask this on behalf of our partner entities as well, is that if an earlier slot opens up and you are looking for that and you would like to take an earlier slot, that you are letting us know so that you can cancel a later appointment that you were able to get into an earlier slot. I understand that is certainly people want to get it as early as possible. So we just ask that if you are able to obtain an earlier spot or a spot at a different partner location, that you contact whoever you had your appointment scheduled with. I know in our appointment system, you are actually able to cancel, but if you run into any issues, please again, contact our call center and we can assist in taking care of that.
Thank you. And I apologize for that background. That wasn't on purpose.
No problem. Thank you, Councilmember. Councilmember Sweet has a comment question.
Thank you. My background is not near as exciting. I first off wanted to thank all of you for your hard work and the amount of information that you have pushed through to our community. And it's been well thought, planned, and I just appreciate it. I know our citizens appreciate it as well. I do have a question, and it's hard to phrase it, but I have an employee who's 20 who asked for a day off of work because she's getting the vaccine. And I said, how are you getting it? She's not a student. She's working at my shop. And she said that she was able to get an appointment down in the Verde Valley because they had vaccines that were going bad. Can you tell me, I guess I just was very shocked to hear that she was getting a vaccine, and this, I think she needed the day off like 2 weeks ago. So wondering.
Well, thank you, Councilwoman Sweet, Mayor Deasy. I'll do my best to give an answer, but again, I don't know each individual situation. That is surprising to me because just in terms of how the vaccine works, certainly there are 5 or 6 doses, 10 or 6 doses, depending on the type of vaccine, that are available in a vial. And so once you start drawing down from a vial, you have to use it in its entirety because it cannot go back. It will not save. And so if those situations occur, then typically what is happening is any entity that is giving vaccination has what we refer to as like a call down list, or we are looking at, okay, who has an appointment already that is, in the future that we could call and get to come in and take that vaccine. There's a lot of stuff going around the country. You've been reading it in the media. I certainly have. So I would question that. Just simply, I know our Yavapai County folks and our partner folks, and so somebody traveling down there, usually those are things that the appointments should be booked. At least that's how we're operating. The appointments are booked, and that there is not vaccine just sitting on shelves or open that is going to waste. So I can't speak to that specific situation, but I have some questions as to the reliability of how that played out. but I don't want to speculate.
Okay, thank you.
Thank you, Councilmember Sweet and Director Musselman. This time I am not seeing any additional comments and questions in the chat box. So thank you, Director Musselman, for all of your hard work and your team. And I think do we have any more for on the agenda for the COVID-19 update before we move forward? City Clerk?
We do not have any public comment on this item.
Okay, great. Well, thank you much. We are down to agenda item number 7. It's an update on city and council legislative priorities. City staff. Thank you. Excellent.
Hello. Just wait for that to go into present mode there. All right, so good evening, Mayor and Council and Board of Supervisors. My name is Sarah Langley, and I am a management analyst in the City Manager's Office. Tonight, I'm also joined by Eric Peterson, the Public Affairs Director for Coconino County. So this evening, we will provide you with a brief overview of the 2021 legislative priorities for both the City of Flagstaff and for Coconino County. So to kick us off, I will provide a brief overview of the city's legislative priorities, and then I'll pass it over to Eric to discuss the counties. And then we will wrap up the discussion with a potential opportunity for collaboration between our two organizations. So before I jump in, just a quick note that my portion of the presentation will be high level, but of course the Flagstaff City Council has put a lot of effort into specifying each of these priorities. So an email will be sent to the Board of Supervisors with the city's detailed priorities in a PDF document for your reference. And likewise, I've displayed each of our priorities on the screen, but for the sake of time, I'll just touch on a few. And I will start with the federal level priorities. So focusing on the economy, completion of the Rio de Flag flood control project and utilization of the $52 million in secured funding really remains a top priority for the city. This will effectively remove the South Side, downtown, and NAU areas from the floodplain and create, of course, economic benefits for those residents and businesses that are located there. We are also focused on advocating for direct payments for cities and counties from the federal government, as well as other programs that support our residents, such as eviction moratoriums and unemployment insurance, as we all do continue to deal with the COVID-19 pandemic. Within the area of community or sort of social infrastructure, we are pushing for additional funding for a variety of HUD programs to help address our housing crisis. And the council is also focused on supporting immigration reform, specifically supporting the DACA program and keeping families together. So we are excited to hear that immigration reform, specifically reuniting families, is a top priority for the Biden administration early on in the presidency. Next slide, please. So moving on to transportation and infrastructure. Regarding the surface transportation reauthorization, we know that current legislation is expiring in September of 2021. So we've been meeting with our congressional delegates to provide feedback on how this upcoming reauthorization could best benefit multimodal transportation in our region. Among other priorities, we're also lobbying for the return of daily Amtrak service to Flagstaff. This is an important service because it obviously generates economic activity, not just for Flagstaff, but for many towns along the I-40 corridor in northern Arizona. We have numerous federal priorities that focus on the environment. So protection of the Grand Canyon and the Greater Colorado Plateau remains to be a key concern for council. So we will be supporting any efforts by the Biden administration or by our Congress for a permanent ban on uranium mining in and around the Grand Canyon. Furthermore, we're also lobbying the Biden administration to reinstate the original dimensions of Bears Ears National Monument. So that for us represents another opportunity to protect the natural and cultural resources in our region. And then in regards to forest health, the city remains focused on leveraging voter-approved funding with federal dollars to maximize the impact of the Flagstaff Watershed Protection Project, as well as other ongoing forest initiatives. Next slide, please. So moving on to state level legislative priorities, our work at the state is a bit different and is really guided by two broad overarching themes, which are to preserve local decision making and to protect and recover state shared revenues. So we're already seeing a lot of preemption bills from the state legislature this year, as well as bills that contain unfunded mandates and proposals to cut revenues received by cities from the state. So these principles will be really critical in guiding our work. Next slide, please. So there are also a number of specific areas which we will be lobbying for at the state level, which you can see on the slide. A key issue for our council continues to be lobbying the Arizona Corporation Commission to adopt clean energy standards. And this just got a bit more complicated with the legislature's attempt to remove this authority from the Arizona Corporation Commission. So we are actively opposing those bills. Related to environmental funding and partnerships, we're watching Representative Osborne's bill, which calls for a $10 million appropriation from the general fund to go to the Arizona State Parks Heritage Fund. So that would be very, very helpful in promoting that legislative priority. And of course, we're pushing for COVID relief at the state level, as well as supporting industries like tourism, which have been very hard hit by COVID, but are also one of the keys to our economic recovery. Next slide. So continuing with our state priorities, we have affordable housing and short-term rentals as some of our top priorities. So in that regard, we're closely watching the progress of Representative Cobb's affordable housing tax credit bill, which has been introduced, as well as Representative Kavanaugh's short-term rental bill, which would give cities some authority to regulate short-term rentals and thereby could potentially impact housing stock and affordability in our town. Related to criminal justice reform, we know that Representative Blackman has already introduced several bills on this topic, so we will be monitoring those. And for rural broadband, the governor has released his executive budget and has proposed setting aside specific funding for broadband corridors. So Eric is going to be discussing this more in depth at the end of his presentation. So with that, that's just a quick overview of the city's federal and state priorities. And like I said, you should be receiving an email with PDF documents of the detailed versions of those priorities. So I will go ahead and hand it over to Eric to discuss the county's priorities. Thank you.
Thank you, Sarah, and good evening, Mayor and Chairman and members of the Council and the County Board. As we go to the next slide, our state and federal priorities from Coconino County. We'll follow the same path and continue on with our federal priorities. Coconino County enjoys a robust federal advocacy plan, and this year, as we were just talking, COVID-19 is our top priority. We'll take a look at the next slide, and we really have two critical functions in that space. The first being direct and flexible aid to local governments that did not receive the CARES Act funding directly, such as Maricopa, Pima, the cities of Phoenix, Tucson, and Mesa. And then also really prioritizing vaccine distribution, dependability, predictability, funding for the vaccine. The way to restart our economy is to get this public health measure under control and really relying on both Congress and the Biden administration to bring forward sound policies and platform goals that will move us forward in that way. We are seeing news that the Senate may go quickly, even possibly next week, in reconciliation on the large America Rescue Plan from the president, which is a $1.9 trillion bill with lots of things in it, including important vaccine information. So COVID-19 is a top federal priority and consuming much of our advocacy at this time. Happy to continue talking about that. But we also have other agenda priorities. As we look at the next slide, forest restoration for Coconino County is incredibly important. Supporting those policies that help us get the timber, this low value timber, into a product and into a market that is profitable to re-incentivize the industry. And then also bullet 2, removing administrative and policy rules that are not a matter of environmental protection, that may be good for the woods and the forests of Oregon and Washington, but are different here in Region 3 as we deal with the forests in the 4-5 footprint. The next slide, we also on the federal agenda are looking at rural economic development and 3 major initiatives here. Rural broadband, which we're going to talk a lot about, leveraging much more federal funding and also unlocking the color of that money so that we don't have to just spend to libraries or educational institutions, but we have people all across Coconino County that cannot get to a reliable broadband connection. And that's where we need to be at, is advocating for people to get connected. That is a matter no different of getting a road to get to work. Getting connected to broadband is being a part of society. And so we are advocating hard for that. Also, Promise Act and energy transition legislation, as we look at the closure of NGS, the decommissioning that is happening. We lost a huge job market in northern Arizona with that closure, with the transition away from coal, which is very good for our environment and stewardship of resources, but also we have an economic impact, and the federal government chartered that plant. It's the only one in America, and we need them to help. We need them to realize their duty as a corporate responsibility to be a part of reinvigorating our economy. And then also Camp Navajo, a win for our community this past year in the National Defense Authorization Act, was transferring 3,000 acres from the federal government to DEMA. That opens that 3,000 acres up for real good economic development potentials, not just forest restoration, not just the military use, the potential military industrial complex use, but also the wide breadth of economic diversification that can happen there with the access to its facilities. We'll go to the next slide. And that should be public lands, which are important. We agree with many of the things the city has brought forward, certainly supporting the Grand Canyon Protection Act. Expect that to be reintroduced in the coming month. Also expect President Biden to actually sign an executive order soon, extending the current withdrawal moratorium around the Grand Canyon watershed. So we may have executive action before Congress codifies that action in the Protection Act. Sunset Craters, a bill we got to a hearing last year right at the end of the Congress. This would transfer 97 acres from the Forest Service to the National Park Service. So where that administrative building sits for the Park Service is actually on Forest Service land. Let's get that cleaned up. It's unfortunate it takes an act of Congress, but we're hopeful to get it done and have good commitments that we're on our way. We fully support PILT and SRS funding. And then also Supervisor Fowler would never forgive me if I didn't bring up the WAVE. The WAVE is a wonderful feature of northern Arizona, highly desirable to get to. It is slated to have an expansion of the number of people that can visit the WAVE daily. We are highly concerned about the infrastructure and the very protection of that landmark. Can it really support that amount of people being on it in the day, going from, I believe it's 15 permits to 56. I'll double check my numbers there before I commit me to that. But again, is there enough infrastructure to handle the people that will walk in, the kind of rescues that we need to do? So always important to us. Our next slide, it will move into the state priorities. What you'll see here is just a little screenshot of our state guidebook, which we published for the first time this year. It's the county version of the Green Book, and we're giving this to all of our legislators, both with contact information about us and then our legislative priorities. Just briefly on state priorities in the next slide, our top priority this year, Bill, we are working on in coalition with all of the cities and towns and counties, is vacation rental property tax parity. The tax side of vacation rentals is certainly a county issue, and this involves where you have investor-owned properties that are operating as businesses, many hotels in our neighborhoods, eating up workforce housing and potential affordable housing to be a short-term rental, but they're being taxed as a residential property, not as a commercial property. Many of you on this call know around our town, we have homes that have been converted to businesses. They are taxed as a commercial property, but these short-term rentals that are Airbnbs, not for long-term residency, are being taxed as residential properties. Very clear to clarify, this is not the house in the back, your accessory dwelling unit. It is not even your second home. This is about the large stockpile of investor-owned rentals. Broadband infrastructure, we're going to talk about this specifically, but we are fully supportive of getting the governor's plans codified and adding to it for first and middle mile broadband connections across rural Arizona. And of course, transportation infrastructure, fully support putting more funding and more priority on cleaning up our transportation funding so that we can have a reliable infrastructure, but also opposing the sweep of HERF funds, or the raid, I like to use that word, of those funds. In past years, when the economy goes down, where's the first place the state looks to cut? They take it out of the money from HERF that flows to the locals to make up their own budget. We'll go to the next slide. And then we'll get to our request for collaboration. A couple other quick items that we're working on are All-Tex cost control. All-Tex is a program run by the state. Counties have no say whatsoever in the All-Tex program, but of all the local, of the state and local funding, it is actually county property taxpayers that pay 55% of that program. Most, if not all, of our public health service tax for the district actually goes to pay All-Tex as part of the state mandates. That county bill, not just for us, but for all 15 counties in 2 fiscal years, went up $37 million. We really need to look at the cost drivers in that program. A couple other things, the property tax deferral statute. This is a deferral that allows elderly owners, low-income folks, to qualify for a property tax deferral. This doesn't mean they don't pay property taxes. The state treasurer actually pays us, the county, you, the city, and others, the taxes owed, and then it goes as a lien on the property if they do qualify. It is so rigorous and tight that you can't actually get many people into it. In the past couple of years, there have been single digits that have applied qualified for the property tax deferral. So the treasurers are working on that. And then a couple criminal justice issues, dangerous, incompetent, non-restorable defendants. There's a civil commitment process for dangerous individuals charged with a crime but cannot be restored to mental sanity to be able to stand trial and restored to competency. And then supporting diversion funding, over 11 million plus in a bill divided across the 15 counties to help create and further diversion fundings to keep nonviolent, low violent, and low impact criminals out of the county jail and our prison population. So those are some of the highlights of our priorities. I'm sure we'll get questions and comments, but we did want to bring up, as we go to the next slide, a request for a collaboration. And this is on broadband and smart highway corridors. Smart highway corridors are the installation of broadband fiber optic conduit along highways. And there's a map here with 3 segments. The blue line is I-17 from Phoenix to Flagstaff. Under the CARES Act, the governor has authorized implementing a smart highway corridor to lay that fiber already. The governor's budget proposal then comes from I-17 and goes west to the California border on I-40 with a smart highway corridor to lay in a fiber optic conduit. All this conduit's important because this allows commercial last mile and middle mile folks to grab on the node and sign contracts and to be able to provide service out to us in rural Arizona. What we wanted to talk about as a potential, and I know Chair Ryan has brought this up to me, is we have been working hard in Coconino County with a study funded by the Arizona Commerce Authority on middle mile studies from 89 all the way to Page and then across to the Four Corners through Tuba City. And we would like to collaborate with you, the city, from the county perspective, in advocating that don't just go from I-17 west, but let's worry about that 3 to 4 miles east through Flagstaff, get out to the mall, a heavy economic area, lay some fiber across the breadth of the city of Flagstaff. From a county perspective, it's important because should we engage on the Highway 89 North conversation on broadband, there would be a fiber optic conduit and a node that we could plug into for that expansion. So our proposal that I am bringing to you, and also as we have talked to your city staff, is that we could collaborate on some advocacy as the budget looks at these projects to not just be, again, 17 west, but to look at those miles to at least get out to the mall area so that we can have a broader connection across Flagstaff. I will pause there, and Sarah and I are happy to answer questions.
Thank you, Mr. Peterson. And if we want to throw some Caesar cues in the chat box, I'll be happy to call on all of our elected leaders who would like to speak. Thank you very much for the presentation, Mr. Peterson and Ms. Langley. It's really great, and I see obviously a lot of overlap in our priorities that we can, a lot of opportunities for collaboration even farther past the broadband. I will say, though, I was actually met with our IT director, CJ Perry, today to look at what vision we have for Flagstaff on improving our broadband infrastructure locally. And this fits extremely well into what has been looked at locally. And I would absolutely personally be very strong advocate to collaborate on such a project to get the fiber out to the mall. And to my understanding, we may already have some conduit from the city to on that route. Council members and our supervisors, do we have questions, comments regarding this? What are your thoughts on our broadband collaboration or anything else with the presentation? Councilmember McCarthy, question.
Well, I just would be interested in a short discussion about when it's appropriate for the government to do broadband and when it's appropriate for private utilities to do it.
Mr. Peterson, were you wanting to respond?
I can take a shot at that. So, Mr. Mayor, council members, members of the board, there is absolutely this conversation going on. I would come back to, we have known the broadband desert that we live in here. We have known that for some time. Was re-emphasized to our community during the museum fire when, of course, Radio Hill, or I can't remember the exact top name there, but when those towers were threatened by during the museum fire, that everything north of Flagstaff would have been without communication because those towers are so critical. The market has not shown up to that cause throughout our community, and certainly not throughout the county. So we know the need. The market has not been there in a great way. The state is talking about these smart highway corridors. It obviously has a need for data along the highways. That's part of the funding they're putting in for this, but also there's a huge market for data center movement. The governor has a couple bills that are part of his broadband package to allow folks to come in and grab onto the conduit to use some of that space. And we are talking with the governor about potentially some of those local uses, not for private sector, but for the public sector use. Whether or not it should be the state or the private sector, that is a great question. I think it's one of the conundrums of government. But the point is that they haven't built it yet. And so we are moving quickly, and especially in the COVID era, into a space where we know we need to have high quality, fast speed broadband connections for our constituents.
Okay, I appreciate the answer, and it looks like there's some other people that may be able to add to it. Good discussion. Thank you.
Thank you, Councilmember McCarthy. Chairman Ryan, followed by Supervisor Archuleta.
Thank you, Mr. Mayor. Is that Councilmember McCarthy putting a rhetorical piece out there? But yeah, I see it. And fair question. And I think Eric covered a piece of it. The state's looking to invest when it comes to our rural areas. Private sector, are they really going to invest that much? If we're looking at our own economy and the state is assisting in the middle mile, a key component, it begs the question of private sector stepping in on the last mile associated with the broadband. I'm glad this was brought up as a potential opportunity. If you look at the map that we have displayed in front of you, we thought, there might be a potential that you've already been working on it within the city of Flagstaff, but we didn't want this element overlooked. Benefit for the city within the incorporated boundary, but it's also a potential link for the middle mile to go to and connect with Utah, which could also fit into state priorities as well as the users along the way, depending upon the state's investment associated with it. Just hopping topics quickly. As mentioned, big gain on the 3,000 acres at Camp Navajo, which is a potential area for varied industrial potential that we know we have a small inventory within the county and within the even within the city of Flagstaff for industrial land. There are plans that we're working on in the implementation team associated with evaluating economic potential for the joint land use study, where we're working with our 2 military installations, but there's a potential crossover associated with these. So continued work together on these certainly would be beneficial. As always, this short-term rental, appreciate that you're working on it. On the regulatory side, we took a backseat with the County Supervisors Association because the cities were drivers associated with this, but we also were present when needed with the conversations. On the other side, where counties would be a primary driver, having that tax equity component, it's been a big discussion within private sector as well, looking for parity on how we would look at these items. So, and transportation, just a note, really appreciate the work that's being done, that they're in both of our packages. I sit as chair as the Rural Transportation Advisory Council, where Metro Plan, also known as the Flagstaff Metropolitan Planning Organization, and NAPTA, indirectly, our transportation goals that we work together on. We also have the COGS, so NACOG, which is 4 counties in the northern region. We were talking to the legislators this past Monday, I think it was, and noting that the House chair is looking at introducing a potential for measures associated with indexing because cost associated with transportation funding doesn't adjust with the consumer price index. So that's an element that has been, as our roads start to fall apart and where we get our maintenance money, that would be a big factor. Also, another element is parity. Again, you can look at certain areas where just as an example of some of the conversations that have transpired over the past couple of years would be like trucking. There's a lot of transition away from diesel fuels, which is great from the climate adjustment, trying to step into those discussions or where we need to advocate. But by the same token, when it comes to where truckers are going, it's not necessarily electric. They are to a certain degree, but they are some of the heaviest impact on roads. And we seek for balancing or adjusting cost. The compensation is shared by all users out there. I could go on forever on that, and I'm not going to do that. We have a long meeting. We have a lot of people that want to talk. Look forward to working together with the city wherever we have common goals in our legislation. Thank you, Mr. Mayor.
Thank you, Chairman. Supervisor Archuleta.
Thank you, Mr. Mayor. Appreciate it. So, yes, excellent discussion. I see several areas for us to collaborate or at least reinforce one another's legislative agendas. I mean, certainly the discussion right now on the table in terms of the smart highway corridors, but certainly rural broadband, whether that be from an economic development perspective or an equity perspective. I mean, obviously, with COVID-19, it's certainly highlighted the inequities that we find in our communities and throughout our county, especially our rural communities with lack of access to broadband, is something that we really want to address. The areas that you have down around environment, the Grand Canyon and Forest Health, the Grand Canyon Protection Act, which we know was the Centennial Act, but it'll be introduced again in under a different title. Certainly see us collaborating on that. Immigration reform, really happy to see that on the legislative agenda. The Board of Supervisors has had that on our federal legislative agenda for a number of years, and so that's certainly an area of great concern and great need for our community. And then justice reform and diversion. Certainly the participation of the City of Flagstaff on the Criminal Justice Coordinating Council is something that we've very much valued, and there's a lot of work that has come out of that group and will continue to come out of that group in terms of looking at alternatives to incarceration, alternatives to bail, and so there's a lot of overlap and collaboration that we can do in that area. But I think one of the things is just perhaps going forward is just touching bases, whether it be through the staff members or through elected official interaction directly, of just how are we approaching the advocacy work of our legislative agenda. Where is there opportunities for us to support one another is what we need to look at going forward. But certainly we plan to be very assertive in our legislative advocacy, especially around COVID-19 and the funding and the needs of our community. And of course, number one on that is vaccines, as you heard in the earlier presentation. So thank you so much for the opportunity to talk about our legislative agenda.
Thank you, Supervisor. Director Perry, do you have a comment before I go to Councilmember Shimoni?
Yes, thank you, Mayor and Council and Board of Supervisors. My name is CJ Perry. I'm the Director IT for the City of Flagstaff. I just wanted to speak to Councilmember McCarthy's comment about public versus private sector. I think the reality is that a combination of both is usually fairly helpful when we can partner with the private sector. I actually was speaking with a fairly large ISP who wanted to bring some fiber to Flagstaff very recently, and the costs of construction up here were so high that they were considering not coming up to Flagstaff at all. And so I've been reaching out to them to try to see like where that partnership could come into being, where they could use some of our conduit to reduce those construction costs, as well as kind of not dig up our roads over and over and over again every time a new ISP wants to come up. So we're in constant communications regarding that and looking for ways to partner. We also have been partnering with Coconino County, my counterpart over there, Matt Fowler, as well as NAU with Steve Burrell and FUSD, Mary Knight. We talk very frequently about this very subject and are constantly looking for ways to collaborate and support each other when it comes to grants and things like that. I will be doing a presentation to the City Council on, I believe it's February 23rd regarding broadband. So we'll have more information and a more in-depth discussion at that point as well. Thank you.
Thank you, Mr. Perry. Councilmember Shimoni has a comment.
Thank you, Mayor, and thank you, everybody, for the good conversation and for the presentations. I think the one strong benefit we have here on this topic of priorities is we share, I believe, both the county and the city use the services of Mr. Bedeska for our lobbying work, and so there is a lot of opportunity for collaborative, supportive work between us, the two agencies. I also wanted just to echo what Ms. Archuleta talked about in regards to CJCC. I think that the city and the county are ready to move forward on this topic at the local level. I know the CJCC is talking a lot about action steps these days, and I know that the city is really excited about taking some steps in the near future, in this upcoming year. I know that County Attorney Bill Ring has been working very hard to help lobby the state as well, and I'm very excited about the opportunity for collaboration there and the work ahead and the progress that we've been making. On the topic of broadband, I like the idea of what we're talking about. I'm going to put on my tinfoil hat for a second and say that I do have some concerns with 5G, and I'm curious as to what broadband kind of allows us to grow into when it comes to 5G and develop when it comes to 5G. I know that the FCC, the Federal Communications Commission at the federal level, oversees 5G and is the one tasked with regulating 5G, not the county, not the city, and that the regulations are outdated. And so this is something I kind of dived into a couple of years ago and kind of hit a wall with. And so I just want us to be careful and considerate about the long-term effects of 5G versus 4G, which is very, very powerful, of an improvement from what we're using today to 5G. And I understand we can't stop it per se, and a lot of towers are already starting to accommodate 5G. Just wanted to put that out there for the group and also for the public, and let everybody know, as exciting as this is, and that the governor is working towards this as well, and we have room for real efforts and strides on this topic at the local and county level. I'm a little hesitant and concerned. So CJ, maybe when you come back to council, we can talk more about the FCC and their regulations and what we know about 5G, and if there's any long-term information we have, which I know we don't have, in terms of its effects on us as a people, and as a climate and nature and the environment and animals, just all of the above. I just have concerns. Okay, I'll be quiet. Thank you, Mayor.
Thank you, Councilmember. Mr. Perry, do you want to comment just briefly on the relationship between the broadband and 5G, or how that 5G would relate to this? Or I don't want to get too diverted in the conversation, because we'll be dealing with that at the city level. But if you'd like to save comment till then, that is perfectly fine too.
Thank you, Mayor. Yeah, I think it would be better for us to wait until we have that more in-depth conversation. I have a little bit of information regarding 5G, but it would give me a little bit more time to collect my thoughts and be able to present that to council.
Sounds good.
Mr. Mayor,
great. Well,
just briefly on the topic, Eric Peterson, just briefly, the governor does have a proposal that will be introduced calling for 5G to essentially speed up the leasing of state facilities, land, and projects for 5G tower installation. So you can certainly discuss that as you wish about your city legislative priorities, but that is one of the proposals the governor is putting out to install 5G infrastructure quicker, is to streamline the state leasing process. So think of the Game and Fish building down near Lake Mary, could have a 5G tower. That type of project could be underway under that bill. So just so to prime your conversations about the legislative process.
Excellent. Well, before we delve too much into it, I would like to see, is there any other concerns of 5G from the other council members? I don't want to have to agendize and put a lot into this from Mr. Perry if they're for staff direction to get into the 5G. Councilmember Aslan.
Thank you, Mayor, for the question, and thank you for raising your concerns, Councilmember Shimoni, but I do not share those concerns. I don't think we need to invest staff resources in this conversation.
Thank you, Councilmember Aslan. I also do not have concerns with the relationship with our this particular issue with broadband specifically. So Let's move on at this point. My apologies.
Supervisor Fowler only has audio, but she's been trying to get in on this.
Yeah, thank you. I was just about to call on her. I apologize. Supervisor Fowler?
Hi, thank you. Thank you, everyone. You know, when we talk about fiber broadband, and we're talking about fiber, and this feasibility study goes all the way to Utah and to the Four Corners, and it actually links is a Northern Arizona relationship. NTUA has already brought fiber into the city of Page from Tonalea to deliver fiber broadband in that most northern region into the Navajo communities and linking into the city of Page. And Tuba City now has fiber that has Navajo Nation and Hopi has been working on this. And then we've been working on fiber broadband since 2010, 11, and we've been waiting for a private company to come in to do a study. But, you know, as it was mentioned earlier, the cost is so great. That's why, you know, you can't wait too long. So government has to come in. You know, phase one is over $48 million, which is along 89. So it would be really good if the city would work with the state and with us and linking, bringing it out to the mall, to the edge. That would really be good. And that way there's a loop also, you know, in fiber. It goes, the A is coming all the way out to those Albuquerque, so there's a loop out that way, and we need to create the same out in this area. So these meetings are constantly taking place throughout the state and with all the various partners. So I just wanted to add that, and I really appreciate the partnership with the city on all the various economic development projects that we're working on, and the Forest Service, all the projects there, the watershed. It is very important that we keep up our working relationship, and I just want to really appreciate the city working with the county. Thank you. And then I know our staff are working together all the time, and I really appreciate that. Thank you, Mr. Mayor.
Thank you, Supervisor Fowler. I will mention, too, on the topic, Councilmember McCarthy, before I take your comment, that as Director Perry had mentioned, that a lot of the time, if the government takes care of the main thoroughfare, it then becomes more cost effective for the private sector to take it up to do the branches into the individual neighborhoods and cul-de-sacs, et cetera. Where if we can get these main thoroughfares, it can create an impetus for the private industry to take it over and expand it further. So I think that's kind of, on my side, that's what I see the role of. It's, you know, similar to we take care of the highways and a developer takes care of the roads for their new development. Oh, sometimes. But anyways.
So, Mr. Mayor, if I may add, this feasibility study and what we're talking about is the middle mile, and into the neighborhood and the streets, that is the last mile. And you're absolutely right. As a government, we're not a utility. We're not the companies that will be building these. We're looking for grants to build the fiber. However, you know, partnership across the board is so important, and we don't plan to become a utility company. So thank you so much.
Thank you, Supervisor. Councilmember McCarthy.
Well, thank you. You know, my question wasn't meant to say that I was against any of this. It was just meant to kind of, you know, hey, let's talk about it. I would be supportive of, you know, an effort to improve our communication networks in a manner very similar to that I support our transportation networks. So I just wanted to clarify that don't read anything in my question as that I was being negative. Thank you.
Yeah, thank you, Councilmember, and I certainly didn't take it that way. Councilwoman Salas, comment.
Well, thank you, Mr. Mayor. Yeah, I appreciate the discussion and the previous comment from Council Member McCarthy. You know, I'd like to see more collaboration and partnership with the county in terms of seeking policy and funding when it comes to transit that that serves our Navajo and Hopi reservation, directly transporting them to Flagstaff. And understand that that's a Herculean task and will require a lot of coordination, at the county level, at the state level, and of course in direct communication with our Navajo and Hopi leaderships. This is a good start. This potential broadband advocacy collaboration. I also want to amp up the collaboration potential when it comes to workforce development. I'm fortunate to serve on the Coconino County Workforce Development Board. So just in the last 2 weeks, the U.S. Department of Labor released about $225 million in grant funding, 145 million in workforce training, upskilling labor force when it comes to IT, cybersecurity, advanced manufacturing, and transportation. And, Tempe and Denver and Tucson received funding. Tempe received 8 million, Tucson received 4 million, and Denver 7.3 million. So, and then there was a 40 million grant funding strengthening community colleges to meet labor market demand for skilled workforce, especially in healthcare, logistics, and cybersecurity. And then the 40 million in grant funds in H1B rural healthcare, addressing rural healthcare workforce shortage. And this is like in pursuing public-private partnership to build a skilled healthcare workforce. So if the city and county and work together, our economic development teams and seek out these funding opportunities, and the 225 million is just funding from the Department of Labor. I'm pretty sure there's some other fundings available out there too at the federal and state level. So just providing amplification on that, and also any opportunity to partner up in business retention and attraction, as well as promoting sustainable economic tourism, not only for the city of Flagstaff, not only for Coconino County, but throughout the Northern Arizona region. And of course, I always wear my parks and recreations and open space hat. Any opportunity to collaborate, to seek policy and funding that promotes our open space, protects our open space natural areas, build parks and trails, and of course, protect our dark skies. And lastly, but most importantly, collaboration and seek PPP, public-private partnership, to increase workforce housing. Thank you.
Thank you, Councilwoman. Councilmember Sweet.
Thank you. I certainly see the value in the city-county collaboration, and I would be okay with working towards a partnership regarding the broadband. Since I am somewhat new, I would like more information, and I'm sure that that'll be coming down the pipeline, and I look forward to that. Thank you.
Thank you, Councilmember Sweet. The one area I would like to emphasize too for collaboration is I think the city of Flagstaff would be very interested in the changing of the tax code for vacation rentals. Obviously, we hit that really hard here locally, as we all know, and anything we can do in that regard, I think the public Flagstaff residents would be very appreciative of. I would also like to mention one area of collaboration that on some of the things that we were regarding COVID wastewater testing. So Dr. Crystal Hepp at NAU has just this week set up wastewater testing at the remote learning centers, at 5 schools here locally. So Flagstaff High, Sonawa Middle, regardless, we're able to test wastewater of different areas. If there's an uptick in any COVID, it creates an early warning system for potentially getting tested and preventing outbreaks. It's to the level where even you could test, for example, the gym, so we know it's actually coming from athletics, or the teacher's bathroom, so to that effect. So this seems to be a real powerful tool, especially as we're looking at next academic year, as well as looking at reopening city and county facilities. That I have spoken with several other mayors and other individuals, Kathy Hoffman, Superintendent Hoffman. Yesterday I mentioned this too, but I would really like to collaborate to see this type of potential wastewater testing around the state, and particularly in the county, our tribes, Tuba City High School, wherever we can get this that can help us provide an early warning system, because we likely won't be able to, at best, start inoculating students, children under 16 years old, until academic year 2022-23. At the earliest, because of the pediatric trial issues. So anyways, that is one area that I personally would love to be able to collaborate, help to create the connection so we can set this up around Northern Arizona and have our great researchers at NAU who can help to monitor our schools when they do reopen, our facilities when they reopen. It's just, I just think this is a great tool to use. So I would look forward to future conversations about this and see what we can do to bring this type of model to the larger community with you all on the County Board of Supervisors. Thank you. Council, do we have any further comments or questions at this time? Excellent. Well, I think we are ready to press on. Was there any other specific areas of advocacy collaboration you were looking to discuss before we move on? Or from staff, was that the end of the presentation, or?
That is it from us, Mr. Mayor.
Excellent. Thank you very much, Mr. Peterson, Ms. Langley, for the presentation. We are now down to agenda item number 8, which is informational items from chairman, supervisors, and county manager, mayor, council, and city manager. Typically, what we do during this session is I specifically call out each council member to see if they have any updates they'd like to say. So following that same format, and just because we're used to doing it that way, I'll start with roll call for the city, and then we'll go to the county if you have any information you'd like to share. So down the list, Vice Mayor Daggett, do you have any information items for today?
Thank you, Mayor, and hello to everyone. I do. I wanted to let people know, let me just pull this up, please, that the Housing Commission is starting a public participation portion of a housing plan, and it's going to the public's going to be hearing a lot more about this, but it's starting now. And I'm hoping that we can get lots of participation from people all over Flagstaff. And also, if people are interested in attending a Housing Commission meeting, they meet on the fourth Thursday of every month at 1 p.m. and it's online currently. And I know that they would welcome more public participation. Thank you.
Thank you, Vice Mayor. Councilmember Aslan.
Nothing tonight.
Thank you, Councilman. Councilmember McCarthy.
Thank you, Mayor. I just might quickly mention that I will be working on the Metro Plan Board, the Flagstaff Metropolitan Planning Organization, as it used to be called. And we work very closely with the county on that. Matt Ryan and I worked on that before. I guess I'm not sure who the new county seats are on that. But anyway, and then the other board that I was not on, but I was on, but I will not be on, is the Mountain Line. And that's another example of where the city and the county work very closely together. And I'm looking forward to those relationships. Thank you. That's it for tonight, Mayor.
Thank you, Councilman. Councilmember Salas.
Well, first and foremost, thank you to everyone who participated tonight and did the presentation. Thank you to the County Board of Supervisors, and thank you to our mayor and council. Let's keep the partnership and collaboration growing and strong. I'd just like to make a quick plug. So February is considered as Arizona Beer Month. And the first week of February is focused on the craft breweries in Northern Arizona. So shout out to our 9 craft breweries in Flagstaff. So please enjoy our craft beers and focusing on curbside pickup. Our Discover Flagstaff team came up with a video promoting our Flagstaff craft breweries. And then another shout out is also to Lowell Observatory, announcing the second I Heart Pluto Festival from February 13 to 18. So there's a series of online events to participate in. So this is this is as a prelude to the 100 years of the discovery of Pluto 9 years from now. So I heart Pluto. Thank you.
Thank you, Councilwoman. Councilmember Shimoni.
Thank you, Mayor, and I want to just take a minute to thank the County Board of Supervisors, especially the newly seated group, Supervisor Horseman, Supervisor Begay, Vice Chair Fowler, and Chair Ryan for your leadership. Thank you for meeting with us. Partnership does work, and we will continue to build upon this partnership. And I also wanted to take a minute to express gratitude to County Manager Jimmy Jane, who is leaving the county at some point. I don't know exactly when, but it's going to come quick. So, Jimmy, thank you. It's been a pleasure working with you. I've learned so much from you. You've inspired me, and we're going to miss you. We really are. And the county is going to very much miss you and your leadership. So just know you're very appreciated by us and the city, and we've gone through a lot of hard things together, and maybe not always the way we wanted them to go, but here we are, and I'm grateful for your service to our city and to our county. Council, thank you. Leadership, thank you, and please be safe, social distance, get a vaccine when you're up for it, and we'll get through this. And I look forward to our meeting in person, hopefully in the year to come. Much love to you all, and be well. Thank you.
Thank you, Councilmember. Councilmember Sweet.
Thank you, everyone, for tonight. And I do not have anything, Mayor. Thanks.
Excellent. Chairman Ryan.
Hop on real quick. There we go. And we've been in meetings all day, and I neglected in the very beginning of the meeting, as you had done well, Mayor, is actually congratulating all the new council members and the mayor, and look forward to working with you. And as noted, these partnerships, we've done regional plans together. You look around the state and actually, we cooperate a lot more than a lot of other jurisdictions. And so we really appreciate the relationship when we have the opportunity to do that. First piece, just to announce and note, recently our school superintendent resigned for personal reasons with COVID-19. With expertise already existing within the office, the board decided that we would appoint a new superintendent. And I am happy to say that Cheryl Mango Pageant, just today, we appointed her to be the actually school superintendent, and she'll fill half a term till the next general election. And then there will be an election to fill the full term of the superintendent for the last 2 years of that particular role. You saw the vaccines. That's our highest priority. We're going to stay on top of that. As noted, we're in the middle of this search to replace Jimmy, who absolutely, we surely love working with Jimmy and look forward to his time as it comes along. And then just a little note that you better hang on to your manager there, because his nephew ran off to Palm Springs and left Sedona. So
no way.
Right, yeah. So we lost Justin. He's been wonderful mayor down in Sedona, but you better hang on to Greg. You got a good one there. So anyway, thank you all. Appreciate it.
Thank you, Chairman. And yeah, I will just reiterate that Clifton, you're not going anywhere. You have to stay with us. Sorry. I think we're to Vice Chairwoman Fowler.
Her computer went down again. She was trying to get back in, and
yes, I just admitted her, Mayor. She should be here momentarily.
There we go.
Okay, Vice Chairwoman Fowler, do you have anything for our information items tonight? I'll go back in case you're having some more issues. Supervisor Archuleta?
Thank you, Mr. Mayor. Just want to say thank you so much for the meeting this evening. Looking forward to working with each and every one of you. And in regards to the FMPO, it's going to be Supervisor Horstman and myself who will be from the Board of Supervisors that will be working with the City Council members. So thank you. Looking forward to future meetings.
Thank you, Supervisor. Vice Chairwoman Fowler, do you have anything for the information item tonight?
Thank you. I just really appreciate our meeting here and a continued collaboration. It is so important to keep the communications open. So thank you so much.
Thank you, Vice Chairwoman. Supervisor Begay, do you have anything for tonight's information items? Is Supervisor Begay on the line? Potentially having some troubles as well.
She is. Supervisor Begay, you may need to hit *6 to unmute your phone.
Hopefully she'll come in, but sometimes she has bandwidth challenges.
All right, well then I'll go to Supervisor Horstman. Do you have an information item tonight?
Mr. Mayor, I'm noticing that she needs to be admitted into the meeting. Her computer may have disconnected. She's trying to get back in. Thank you.
Well, actually, and depends on which one. Supervisor Horstman has her mute on there.
Supervisor Horstman? Or Supervisor Begay, do we have any information items tonight? So this is only reinforcing why we need more good broadband infrastructure. So, all right. Well, then I will just say I am very much looking forward to our the partnerships and continued communication, as well as learning from you all and sharing ideas. And one thing I did want to mention is that when we come to vaccines and vaccination efforts, I've been really trying to press this, make it a big thing, get as many people to get vaccinated as I can. I know supply is down, but trying to normalize the behavior. And I'd love to discuss with each of you some communication strategies, things I've been thinking about, so that way we have some really great messaging for the purpose. No problem. In particular, I'll just give an example here. Herd immunity is definitely the technical term, obviously, but I don't think that is something that sells very well. And using even community immunity is kind of a mouthful. So I've been thinking about, for example, collaborative immunity or something to this effect that can make it a little bit, well, maybe be a little bit more palatable. But anyways, just throwing one idea out there. I have a lot of others, and I'm looking forward to speaking with each of you individually and collectively in the future. I did see Supervisor Horstman. Are you available? You have an information item?
Mr. Mayor, this is Julian Wolf. I have Supervisor Horstman on my phone. I believe she's she should be able. 1 second. Okay, I'll get her on for you.
Okay.
Okay, here's Supervisor Horstman.
Well, this may or may not work. We'll have to see. I have been uncharacteristically quiet because Teams seems to be acting up, but it is marvelous to be here with the City Council, and it's great to see you all. And I also wanted to congratulate you, Mayor, and also Becky Daggett, Miranda Sweet, and Jim McCarthy for your wins, election victories as well. And I look forward to working with you all. And I do have just a brief update, and that is that I have been working with both Representative O'Halloran's office and also Senator Kelly's office with regards to phase 2 of the Mount Eldon Estates museum fire flood mitigation, and trying to get the grant funding for hazard mitigation funding on going forward on phase 2. So a little bit of an update. And Adam, I don't know how to tell you this, but I'm now on the CJCC board. I look forward to working with you. And Jim McCarthy, I'm on the Metro Plan board, and I look forward to working with you as well. So thank you all for this wonderful joint meeting, and I hope it is going to be a wonderful collaboration moving forward. So thank you all.
Thank you, Supervisor Horstman. Councilwoman Sauce, you have your hand raised? Oh, okay. Maybe it was just a press a button. Just to check here.
I'm sorry, Mr. Mayor. Just a request for a group photo, but I figured we are not all online via video.
Yeah, I like that suggestion, but I think we might be having some technical difficulties.
Yeah, I got a text
Hello?
I got a text from Supervisor Begay that said her phone had gone out.
I'm back. I'm back on the
there
line.
you go. There you go.
Oh, great. Supervisor Begay, do you have any information items for tonight?
No, we've just been meetings all day long, and I just wanted to introduce myself. As you know, I'm the newly elected District 4 Supervisor. My name is Judy Begay, and I've come from Coal Mine Mesa, east of Tuba City. And I'm just really glad and really honored that I'm part of the whole team for the Coconino County, as far as the city and also for the county offices. You guys are doing a great job, and I just want to really stress that partnership is very, very, very important. If we all pull together and, plan together and work together, even through MOAs, MOUs, whatever it may be, people that are out there that may have grants, know how to write grants, if we can pull them together too, I'm pretty sure, things are going to be easier for us. So I just want to thank everyone for their leadership. And I also want to thank everyone for being a part of this group here also, and also the others, the staff on both sides of the city and also the county. And then also our key players are the people that are out there that voted us in. They have faith in us and they believe in us, and they know that we can do the job. And, I just want to say, I'm very honored to be part of this whole team. And I just want to thank everybody for their sharing of the information that they did. And we're all, safe and sound. And just want to say thank you very much.
Thank you so much, Supervisor Begay. I do believe we have a public participant, and we're down to agenda item 9 for public participation. Ms. Fuller, do we have the individual on the line?
Yes, sir. Please go ahead, introduce yourself, and you have 3 minutes starting now.
Hey, this is Enoki Jr. I am a graduate student from NAU, and housing affordability is a dire situation for the county, particularly in and around Flagstaff. There's been a lot of talk by the city council about how terrible the housing affordability situation is and how some things should be done, but it feels like no action has been taken outside of symbolic resolutions. In fact, during the previous city council meeting, you chose to prioritize 3 projects: the high occupancy housing amendment, the 45-foot building height limit, and heritage preservation that are in direct conflict with housing affordability. To your credit, you also prioritized affordable housing incentives. But while those have the potential to help some of the poorest residents along, they will not improve overall affordability. So I ask, what direct actions do the city and county government have planned to improve housing affordability? Are you going to exempt parts of the city, direct the Planning and Zoning Commission to grant more conditional use permits, fast-track development of some of the empty lots around town, reduce mandated setbacks, or are we just going to keep giving us symbolic resolutions without a real impact for those costs burned by housing affordability? Thank you.
Thank you. And just so you're aware, we are unfortunately unable to comment or ask you questions, as this is in the general public participation. But please email council and myself and county to have those questions, and always happy to communicate. Thank you. And that was the only item, Ms. Wobar, of public participants, correct?
That is correct. Thank you.
Well, excellent. This is exciting. I'm very excited. To all of our board supervisors, our council. This is one of many meetings to come, and I'm very much looking forward to collaborating with you all. So that being said, this meeting is adjourned. Thank you.